them with the facts, not fear. Joining us today, Dr. Andrew Carroll, who's on the board of the American Academy of Family Physicians. Dr. Carroll, we thank you so much for joining us.
Hey, Trim, how you doing?
I'm doing well, knock on wood, thankfully. All right, let's get to our viewer questions here. One viewer, Wendy from Chandler, texted us this question. Our senior community pool is still open because we're told there is no evidence the coronavirus spreads in treated pool water, but is this really safe?
That's a great question. So the CDC website does note that they're in a treated pool with chlorine or bromine, that there is no transmission in the pool water. But remember that as you get out of the pool, you're grabbing a banister, you may be touching a shower handle, you may be having to open a door to get in the locker room. So keep in mind those contacts, wash your hands a lot. Even if you've just gotten out of the pool but you've touched those surfaces, wash your hands. And if you can't wash your hands, use hand sanitizer.
All right, another viewer, Bev from Mesa, wants to know this. If we've had the pneumonia vaccine, are we protected from that phase of the illness of coronavirus at least?
Okay, so the pneumonia vaccine protects you against strep pneumonia, which is a bacterial pneumonia. And in some cases, the coronavirus does lead to what's called a bacterial superinfection, which is strep pneumonia or other types of bacterial pneumonia. However, we believe that most people who are dying from coronavirus are dying from the effects of the coronavirus itself, not from a bacterial superinfection. So yes, your risk might be reduced, but your risk is certainly not zero.
All right, another question from a viewer here. How many times can a face mask be used?
So if it's your own face mask, you can use it as often as you'd like. If you're having to go, like for me, where I'm going patient to patient to patient, unfortunately, you should not be using a mask between. Now, if you're at home and you're using your own mask and you're worried about the sterility, you can hold it above a boiling pot of water for 10 full minutes, let it dry out, and that usually sterilizes the surface. The other option is just to let it sit out. 8 to 10 hours, whatever was on your mask before is now going to be gone.
And again, when we're talking about the masks, they should only be used on people who are sick, correct? Not on healthy people.
That is absolutely correct. It's not going to protect you from getting the illness unless someone coughs in your face. If you are sick, you should wear a face mask, absolutely. But the best way to protect yourself if you are not sick, wash your hands, practice social distancing.
All right, Dr. Carroll, I have a couple of questions myself. I know that when we were talking earlier that you had mentioned that you actually had a couple of patients who tested positive for COVID-19. Can you tell us some of the symptoms that they had?
So I've had two patients now, one last week who I diagnosed with COVID, and then one this morning that I diagnosed with COVID. The one last week, he looked like a flu patient. He was sick. Body aches, fever, cough, everything. Thankfully, we were prepared. We masked up, we gowned up, we got him in. We tested him for flu, and the flu test was negative. So that's why we went to a COVID test, which turned out to be positive. This gentleman that I did today, he was positive. He was with some friends on a trip. Those folks turned out to be positive, and so we tested him, and he's positive. He has no symptoms. He feels great. So we've told him to quarantine at home, protect his loved ones. So if you know that you've been around someone who was already tested positive and you spend a lot of time with them, you may want to ask to be tested yourself.
Okay, we know that 80% of these cases are usually mild symptoms. So in your first situation where it seemed as though that person did not need a ventilator, it didn't seem too serious, if I'm correct. What do you tell the patient? How should they proceed afterwards once they know that they test positive for COVID-19?
So right now we're asking anyone who feels that they might be sick, but maybe not too sick, quarantine as if you knew you had COVID, even if you don't know. Because you may have that mild illness that is going to last 7 to 14 days, and you don't want to get other people sick. For him, what we did was we told him, look, stay at home, stay away from anybody who you might normally come into contact with. Let everyone else know who you did come into contact with that you were positive. Watch your symptoms. take medications to help you with your symptoms. Over-the-counter cough and cold medicine does just fine. And if you get sicker, if you start to have a lot of trouble breathing, a lot of a fever over 102, or just getting really tired and worn down, you think you're going to have problems breathing, call an emergency room, let them know that you have coronavirus, that you feel that you're getting a lot worse and that you need to come in. That way the emergency room is prepared for you so that they can take the precautions necessary.
All right, excellent information to know. Dr. Carroll, we thank you so much for your valuable time.
Thank you, Tran.
Stay up to date on all the latest news by downloading the 12 News app for the facts, not fear, on coronavirus. And email us your questions on Facebook or text them to Team 12 at 602-444-1212. Up next, while you watch